Hello, I'm Gavin and I'm the Head of Counselling here at NUIG Galway, and I'd like to tell you a little bit more about the counselling services that we have on offer. I'd just like to make a few general comments about counselling and then to talk about some of the specific approaches that we use. Counselling is a form of psychological and emotional support which relies on talking alone. It provides a regular time and space to talk about troubles and to explore difficult feelings. It happens in a secure, confidential environment, and one of the clear things is that there is no sort of judgment involved. We deal with whatever people bring to us and try and provide whatever support and help that we can. But being listened to and being understood helps to gain insight into feelings and behaviour, which in turn opens up new perspective, new options, new choices in ways of behaving for the future. Counsellors listen and comment from their own particular professional perspective, and a lot of those are fairly similar, but there are subtle differences in emphasis, and it can be quite interesting and helpful to know about these. Sessions usually take place about once a week, and it's important to see it as a regular commitment, as an investment in oneself, because if one does that, then there is the greatest opportunity to actually get to the heart of whatever difficulties one might be experiencing. All the counsellors at the Student Counselling Service here are professionally trained and they're accredited by various different bodies. And while we all work in a broadly similar way, there can also be some differences in approach and in emphasis. And the rest of this presentation will be about giving you some idea about the main types of counselling that we offer. And it's important to say at the outset that you certainly don't need to know any of this in order to come and seek help. But people are curious, and if you're trying to make a decision about whether it's something that could be helpful to you, and if you're curious, then this is an opportunity for you to learn a bit more. I'll start off with the first session, and it's in that initial assessment that counsellors will try and judge what kind of counselling would suit you. They listen to the reasons that you've come to counselling, the difficulties you're experiencing, the history of those difficulties, and they might also see the first session as a chance to see how you respond to their way of working. And also the whole question that we can't often pin down, but the question of sort of fit between whether you and your counsellor feel that you can work together. And sometimes that can be very hard to explain those sorts of factors or what might influence that. But the first session will be, that will be part of what will be happening in the first session. We usually offer 6 sessions. But there is some flexibility within that. If the student is particularly upset or disturbed, if it's at risk in some way, risk academically, or other kinds of risk of self-harm, if it's been a long-standing problem, if it's complex, if perhaps in some cases there might be a mental health difficulty. And again, sometimes it could be that counselling isn't the best form of help, in which case we might suggest or refer a student to another service. But what usually happens, the first session is the assessment session, and from that an agreement is made between the counsellor and the student about what the best course of action would be. And sometimes for some students, coming to that first session actually getting a different perspective, because as we all know that often when we have troubles or difficulties we think of going to our family or friends first, and that's great, that's as it should be, but sometimes that doesn't always work. It could be that some of the difficulties might concern family or friends. It could be that you might feel that you could have worn your friends out talking about this particular difficulty. It could be equally that your friends might have opinions on it, strong opinions, and actually what you need is some space away from strong opinions to think about things yourself, and that's the kind of space that counselling provide. Then once an agreement for further sessions have been made, then that's a regular commitment which hopefully you will then carry on with. when I talk about the particular approaches to counselling as follows, I mean, if you find that one or other approach you think would be particularly helpful with your problem or your difficulty, then certainly you can make that request. But I have to say, particularly at busy times, it might mean a longer wait. And also just to remind you that actually counsellors do work in a broadly similar way. So here we go. I'll start with psychodynamic counselling and some of the core ideas there. I mean, if you have looked at any media representation of counselling or of psychotherapy, even you might have heard of psychoanalysis, which goes all the way back to Freud, and you might see the caricatures of somebody lying on a couch with a very serious looking person with a beard standing behind them, umming and ahhing occasionally, nothing much being said. Well, although some of the core ideas that psychodynamic counselling operates with are derived from that approach, that's certainly not the way things happen these days, and things have changed quite considerably, and that there is a lot more interaction and talk. But some of the core ideas that are worth bearing in mind from a counsellor who's psychodynamically trained is the aim is to provide self-understanding, to be able to talk about one's feelings, to acquire some insight into difficulties, and an awareness of, I suppose, what's going on inside you in your inner world, and how that influences how you relate to the external, the outer world that we all live in. A key concept is that past experiences have a bearing on experiences and feelings in the present, that the past is not, doesn't disappear once it's happened, but it still continues to exert an influence, a greater or lesser influence at different times. So related to that, important relationships, perhaps from early life on, may be replayed with other people. We would also, psychodynamic counsellors would also stress the unconscious factors in how we react to situations, the things that we don't know about. And these unconscious factors can influence things like certain repeated patterns of behaviour, certain kinds of relationships, even relationships or situations that we know in our conscious awareness are not useful or not helpful to us, we find ourselves back in them again. And psychodynamic counselling is an approach to counselling which tries to uncover why that might be the case. And within that, the relationship with the counsellor is particularly important, and one of the concepts we use is the concept of transference. And what that essentially means is that some of the earlier relationships from the past will be replayed in the present in the relationship between the here and now and the counsellor, so that you might, for example, if you've had negative experiences or negative responses from people, you might impute some of that to the counsellor. You might imagine that the counsellor is viewing you in that way. But this may seem like a very difficult situation, and in many ways it is, but actually it's also a wonderful opportunity to explore perceptions and to explore the reality or the lack of reality behind them, and how these sorts of perceptions or projections is another way of calling it, can actually influence a lot of the ways that we react. So the counsellor, the psychodynamic counsellor in particular, really tries to get to the roots of the problem by helping to bring sort of hidden aspects of difficulties into one's awareness. Person-centred counselling would also have been a kind of counselling that also derived from psychoanalytic thinking initially, but moved in a slightly different direction with a different sort of focus. So the counsellor, the humanistic or person-centred counsellor, would provide three essential attributes which are themselves therapeutic. Empathy, the ability to imagine oneself in another person's position, unconditional positive regard, having warm and positive feelings towards the client. People who come to seek counselling we often refer to as clients, client and counsellor relationship. Congruence, being open and being honest, being available to one's client, to listen without judgment. The counsellor, again, similar to the psychodynamic counsellor, really places a lot of emphasis on the relationship as a means of healing and of change. The Person-centered counselling is based on the belief that people have an inherent tendency towards growth, towards development, to what's called self-actualization, and that the person-centered counsellor helps people to understand. It's a source of healing and change, but helps people to understand what it is that might be preventing their growth. I'll now move on to some very different approaches. Cognitive behavioural therapy, that's based, one of the core ideas there is that thinking patterns affect feelings. So for example, negative thought patterns often underlie difficulties to do with anxiety and depression, and CBT, in its shortened form, has been found to be particularly effective in relation to anxiety. We know that perhaps when we feel anxious or depressed, there's a lot of automatic thoughts that we don't often necessarily think about, but if you, and CBT would encourage you to bring this to the surface and to look at it. Automatic thoughts, I'm useless, I'm worthless, I can't get things right, things always go wrong for me. Those kinds of thinking, each person has their own specific set. So CBT might help you to find out what those are, and then to develop strategies to actually challenge and to change those. And CBT is a very structured way of working, and so for example it could be that if you're working with a CBT therapist, you might be asked to do homework or to do some kind of assignments between sessions, which is perhaps different from some of the other approaches. Another approach I want to talk about is sensory motor therapy. That again is a talking therapy, but it focuses on past difficulties, but particularly past traumas, how they're stored not only at the cognitive and emotional level, but also stored physically in the body. And so this approach would try to integrate thinking, feeling and bodily sensations in order to try to overcome past difficulties. So the main focus will be on talking, but the sensory motor therapist might actually ask you to pay attention to how you're feeling, what physical sensations you're feeling, particularly if you're describing something that's been painful or difficult to the past, and to try and look at how these physical sensations might be related to early trauma. And related but different in many ways is something called EMDR. Now that's more of a technique, and the focus there is also on trauma, but it's on more specific traumas, perhaps a traumatic event. And so once one has experienced a traumatic event, some of the feelings associated with that can easily be triggered, and sometimes in a very disabling way. EMDR is a technique which actually helps you to be able to understand what those feelings are, but to try and tolerate them and remain in the present, and with the confidence that those feelings will subside, and that they're not going to be there continually, and that as you begin to recognize and understand them, then their power will decline and decrease. So that's a source of healing, but it is particularly helpful for specific traumas rather than the complex and the kinds of traumas that are more cumulative and are more associated with relationships, perhaps. Now I'm going to move on. Solution-focused therapy. If you're working with a solution-focused therapist, they will probably stress the past to a lesser extent. But what they'll aim to do is to strengthen and help you to develop your own coping skills. That there'd be an emphasis on looking at the difficulties that you're currently experiencing, but actually how you've coped with them, what works, and actually how to do more of it, how to strengthen those coping skills. And there'd be a focus on your goals and how to achieve them. So I suppose this is a little bit more, it's got some similarities with life coaching, but it is about emotional difficulties. But the focus is more how to get things right in the future and how to strengthen the things that you may be already doing, which are probably helping whatever they are, your ways of coping with whatever the difficulty might be. Motivational interviewing and brief interventions. These approaches are more often used to do with issues of substance abuse, and it's a very much a very active process, a lot of questioning, a lot of thinking about your current behaviours, the pros and cons of your current behaviours, why you keep doing them. It can also be connected with, for example, if there's an issue about drugs or alcohol, how to reduce the harm that they might cause to you by looking at your drinking patterns, how much you drink in particular situations, how you might decrease that, the relative damage, I suppose, caused by having additional drinks. So it's really, this is about your motivation, trying to understand the sources of your motivation and trying to change it and channel it into more positive directions. The last aspect I want to talk about is about group work, and just before I go on to that, to say that the approaches, there are many more approaches to counselling and therapy than I've outlined, but I've just focused on the ones that are most represented in the service that we have here. Now, we do a big program of group work within the service, and sometimes when people think of joining groups, they can be a little fearful, a little bit anxious. Do I want to expose myself to what other people might think? It'd be difficult to talk about things. Nobody would understand me. Being in a group is a challenging situation. So that's one's first thought, but actually if one goes on to the second thought, you might also recognise that it actually has an awful lot, working in a group has an awful lot to offer, and an awful lot that actually can't be achieved in quite the same way in an individual one-to-one situation, and that there's a particular mixture of challenge and of support. Groups are a big part of college life, they're a big part of life in all its aspects, and how well we get on in the different groups we're part of, social groups, family groups, activity groups, has a big bearing on how we feel about ourselves. So if we get on well in groups, generally speaking, that makes us feel secure and happy, we belong. We get support from those groups, but sometimes in groups we experience problems. So if you experience a problem in a group, then actually a group can be a very good place in which to explore that problem. So rather than talk about perhaps the roles you get into with your one-to-one counsellor, in a group situation, you actually have it happening in front of you, live as it were, and you can also get a lot of different feedback, because members of a group are very supportive to each other, and members of group can either feel the same as you, empathise with your feelings, or you might be surprised and intrigued to find somebody in a group saying, oh, well, when I had that situation I thought about it completely different, or there is this aspect to it. So it's a very enriching way of working. Having said that, there's a lot of different types of groups that we do. Some of them are short theme-based groups, some of them more related specifically to academic themes, such as procrastination or managing anxiety, improving self-esteem. Some of them are focused on learning coping skills, mindfulness, which is about relaxation, a different way of standing back and observing one's thoughts rather than be taken over by them. People who are very anxious often find presentations difficult, so we've got groups that help students do that. Experiencing different experiences, exploring the impact of that. It's sadly a very common experience for students to have members of the family who may have been involved, maybe alcoholics, or there may be an issue about alcohol which has dominated perhaps their childhood, or they may have a partner with this difficulty. So sharing that within the context of a group is tremendously helpful and supportive. And then we also have some therapy groups. And therapy groups are very wide-ranging and broad. Whatever material is discussed in the group is actually brought by the group members. And so that if you can call it, the leadership is really from behind. The group therapist wouldn't bring in topics or themes to talk about. More, the themes and topics would emerge from what the members of the group bring, and that the role of the group therapist would be to try and look at what's behind all of those and to try and help people to support each other. And it can be very useful either for people who've had some individual therapy but feel that they need something else, or it can be again helpful for people who feel very isolated. In fact, there are very few people who can't be helped by a group, so I hope it's something that you will give some consideration to it. Our programme for groups is different each term, so that will be available on our website at the start and through other channels at the start of term, and it's usually advisable and in some cases essential to actually meet the group facilitator beforehand, so that if you have any questions or thoughts or concerns, you have an opportunity to actually ask about those and discuss them before making a decision to actually join a group. And last point, leave you our contact details. This very nice picture was taken in our back garden. We're on Distillery Road, which is on the campus, but it's in a terrace, a very discreet terrace of houses on Newcastle Road. And once you come into that environment, then all the people you meet in there will either be staff working or other students who've come for the same reason that you have. And it's a very nice, welcoming and homely environment. And I think I'll leave it at that. Thank you for listening.